Hi, I'm Aubrey Gowing, and today we're going to talk about shin splints. Shin splints is a generic, non-specific term that really just describes pain in the lower leg, somewhere between the knee and the ankle. There can be a number of different causes for this condition, but one of the most prevalent is a condition known as compartment syndrome. So muscles are grouped together in fascial bags known as compartments. And here we see the fascial network of the body. And we'll take a look at the structures now in a moment and see how muscles are contained within their own fascial envelopes, and then how muscles are grouped together to form fascial compartments. We actually have 10 different muscles in the lower leg, and they're divided into 4 different compartments. So here we see them numbered. At the back, we have the posterior compartment containing gastrocnemius and soleus. And then underneath that, we have the deep posterior compartment marked as number 2 here. And that's containing 3 different muscles, our posterior tibialis, flexor digitorum longus, and flexor hallucis longus. We have similar muscles in the front, but we have an anterior tibialis, a extensor digitorum longus, and extensor hallucis longus. And what these muscles do is create movement. The anterior compartment muscles lift the foot and toes to create a motion called dorsiflexion. The posterior and deep posterior compartment muscles then perform the opposite motion, known as plantar flexion, pointing the toes away from us. Anterior and posterior tibialis can also work together to create a different motion where we lift the inside edge of the foot, and this is known as inversion. The opposite motion is done by the peroneal muscles or fibularis muscles on the outside, where they lift the little toe side of the foot, and this movement is known as eversion. It's important to remember that painful muscles aren't necessarily tight muscles. Frequently used muscles tend to be bigger and they get stronger, but they then cause weakness or inhibition in their opposite, antagonistic muscles. And as the frequently used muscles get tighter and tighter, their opposite muscles get weaker and weaker. Either can be painful. So here's the compartment that's containing those deep posterior muscles. Here, where the client has had an emergency fasciotomy and the outermost layer of the muscle fascia, the epimysium, has been cut, we gain an appreciation of the role of fascia in containing structures and giving them their characteristic shape. But you can see the fascial envelope around these muscles. And what can oftentimes happen in shin splints when we get a compartment syndrome is when we start to use these muscles, they become filled with blood, they become suffused with blood. As a result of that, they start to expand. If the connective tissue hasn't had time to warm up, as these muscles, like our posterior tibialis, start to warm up and expand, they actually become squeezed and compressed within their own fascial bag or fascial envelope. The constricting force exerted by these fascial compartments is exacerbated by the typical patterns of muscle imbalance, causing and contributing to fascial migration. We have to address the tightness in the tight muscles through therapy and stretching before we can really correct the weakness in the painful muscles. So proper home care is really important. For these muscles, it means then that for the weak muscles at the front, like anterior tibialis, we want to do strengthening work to help tonify them and draw the fascia back up. For the posterior compartment muscles, like our posterior tibialis, we want to try and stretch this guy back out. We want to try and move the fascial compartment, the fascial envelope, to stretch it back down. Where the fascia has a tendency to migrate back towards the fixed end, the origin of the muscle. In tight muscles, the fascia will migrate proximally. We get the opposite effect in a weak muscle where the fascia tends to migrate distally. Hope you enjoyed this short video and found it helpful. If there's subjects you'd like to see us cover in future videos, particular injuries or explanations of anatomical structures, please do get in touch with us either by leaving a note in the comments or you can email us at info@hcd.ie. You can also find information on our training seminars as well as our resource materials such as DVDs and books on our website. It's hcd.ie. If you'd like us to travel to you to provide a seminar in your area, please do get in touch. Thanks for watching.
Have you considered becoming a certified specialist? It's a tangible marker that your services meet nationally recognised standards of excellence, enabling the public to make informed choices when looking for a massage therapist or myotherapist. The opportunity to become a certified specialist is open to all therapists nationally. For more information, visit massagemyotherapy.com.au/certification.
Hey folks, Dave Sheen here from Connect. Really excited today to have Kaz Cleary with me. Welcome, Kaz.
Thank you.
Now, Kaz, you're a physio.
Yes.
And I guess the best place to start is why? How long ago and why? Whereabouts did you study? A bit of background.
So many reasons why. I studied my physio degree at the University of Queensland.
Oh, okay. So you're not a local?
I am. I moved there. I defected for a couple of years so that I could get the degree.
Okay,
that was
great.
the only reason. I did 3 years in Brisbane, beautiful campus, lovely weather for the most part, and then came back because nothing beats Melbourne.
Yeah, absolutely.
Why I became a physio? I had too many injuries.
Okay, and this was in netball? Yep.
Only not real coordinated with sport, but super coordinated on the netball court, and injury, netball, injury.
So were you sort of were you playing high level netball, or was it sort of weekend warrior stuff?
No, like a bit more high level than not. And I think it was something like my 4th or 5th or 6th ankle sprain and whatever else I had that I realised people, I think I would have been a teenager, would have been maybe year 12, 18, 19 years old, when I realised that people not only from my team but from other teams at the centre were coming to me and going, I've done this, can you look at my blister, can you tape this? And I'm going, sure, let me get my bag, which is my netball bag. I had my shoes in it and my gear, but in the end pocket I had a first aid kit that I thought was normal, that everyone had one. They didn't.
No, they didn't. So
I was just helping people, and I thought that was really cool.
Okay, cool. As far as pathways, I asked a few people this question on the Connect show because it's an important part, because some people who are remedial myos in particular are interested in different pathways, and you see out there people heading off to do osteopathy. But as far as physio, I mean, is the pathway easy for people if they're interested in going up to that next cog, into that sort of tertiary area? Is it from an educational point of view? Would you say there's a big jump between what's learnt in the sort of the diploma up into heading into what is a master's? I guess the physio.
Yeah. I'd say that there's a bigger jump from, if we go the myotherapy degree. There's a bigger jump going from the myotherapy degree to the physio degree than there is from the myotherapy degree to the osteo degree. Physiotherapy is based more on the medical side of things, so most of the teachings are not really musculoskeletal.
Sure.
For my degree, I did the postgrad, which was a 2-year accelerated degree, which is most that people would try and get into because it's quicker.
Yep.
And how many subjects do you have a semester? I think I had 2. That were, so 1 upper body, 1 lower body. The rest was paediatrics, gerontology, other systemic type stuff, cardiovascular, all that kind of stuff.
Okay.
So yeah, it's a lot more hospital-based learning.
Yep.
When you come out, you get to choose from 9 different specialties.
Okay. And your specialty, paediatrics is kind of. Yeah,
it's tricky, because if you say the word paediatrics to the majority of people, they think under 18s, because when you're 18 you're an adult.
But it's not.
In the medical world, it's babies.
Right.
So
okay.
They don't run, so I can't really help them.
Right. So what's your focus in clinic? Do you have a?
Yeah, I probably call myself like older children and adolescents into the young adults. So the majority of us humans don't finish growing until we're about 26 years old.
26. Yeah.
Yeah. So up until that stage, I still consider, especially males, I still consider them to be in that growth phase.
Yeah.
Not just mentally, but also from their body.
Nice. Just charming. And as far as the patients that you see, is it injury related or sort of genetic sort of conditions, or what sort of people are you seeing on a day-to-day basis?
I think the vast majority is injury related.
Okay.
Because where I work down in Sandringham, down the Bayside in Melbourne, they are very active, very fit, very proactive about their health. And that's why I like it there. We get people coming and going, I think I have a bit of a niggle. I think I maybe tweaked something when I was doing my 10K run. And they're people that I see more often. You see actual injuries. So I've sprained my ankle, I've done my ACL or whatever it is. But I see a lot of people who are proactive. In the past, I worked in different areas and they're a bit different.
Okay, cool.
A bit slower, a bit longer with their recovery. But I like people who want to get better quicker.
Okay.
Because that's where my brain goes.
Yeah, absolutely. Now, it seems like you're a bit of a workaholic as well, because there's not just the clinic side of things. There's a whole lot of other varied areas of interest in your professional life as well. One being teams.
Yep.
So you mentioned just before we started coming on air here that apart from netball, you've also last year you went to Italy on the InterVarsity games as well. So do you want to?
So cool.
Was that fun? Because
the best.
people love to hear about these experiences. We had. I'm not sure if Rob Granter has been shot earlier or later for an episode, but I had him in here for an interview and he talked a lot about the Olympic teams, and it seems like it's a great thing to do. But you've got to be doing it for the right reasons. So, and money is not one of them.
No.
So, do you want to just talk about your experience?
Do it for the money.
No, last year.
Yeah, so it was July 2019. Slight backstory. I was sent an email, like a thread of an email through higher up people asking for physios that want to go to the University Games. I got that because I was on the mailing list because I did the Commonwealth Games in the Gold Coast the year before.
Oh wow, that would have been fun.
I forgot about to tell you that.
Yeah.
And it's just, I think once you've done something, they kind of just keep your emails and go, this is your first offer because you've been here before. So I applied for the World University Games and got it, and I got a ticket to Naples and spent a couple of weeks down there.
So that was in July?
That was July, yeah.
So that's summer. So it would have been pretty nice.
Yeah. Would have been nicer if it wasn't boiling hot.
Too hot, okay.
It was very, very hot.
Yeah.
The air conditioning is a bit poor, but we had aircon, so it was okay. It was...
So what was your day? What did it sort of consist of?
Amazing. So you get up super early. From what I've been told, these types of events, because there's so many people, it's the closest games to an Olympic Games when it comes to organisation. So it goes Olympics, World Uni Games, Commonwealth Games. So we got a bit of a taste, or all of us got a bit of a taste as to what it was like. And one of the biggest things was transportation, because there's thousands upon thousands of people that need to be in different places at one time.
So the logistics be insane.
Nightmare, yeah. And then the English barrier as well, because we're all silly.
Not fluent in Italian, yeah.
And so I was getting up early, catching a bus that should take half an hour. It takes about an hour and a half to 2 hours. Going into the main hub, which was the medical hub, so it was a medical room, a physio room. We had our admin, and that was the entire world, or the people, the countries that were there, all set up. Ended up being at the port where the ships come in, because they need a big space, and they just sectioned it all off. And we had a run sheet for the day outside our door. The athletes would come that wanted treatment, that weren't playing that day or had injuries to be strapped for, that had their name and times outside the door. So there was at least one, if not two, physios stationed there the entire day. So from about 8 a.m. early if they needed to be, 8 a.m. until about 9 or 10 p.m. at night. Sometimes we'd swap if they were getting a bit bored or a bit stir crazy.
So how many days was this over? What was the duration?
10 or 11 days.
Yeah. So it's pretty hardcore.
With no days off, because the sports have the day off. So if diving's on Monday and Wednesday, then there's gymnastics and everything else on the Tuesday and Thursday. Like there's other things on, so we don't get a break.
And you would have noticed different ways or different aspects of treatment for different disciplines, sporting disciplines. There'd be different issues going on. Yeah.
Or something like diving, which you don't generally see a lot of. Their biggest problem by far was their wrists. So when they land in the water, because they're coming from such a height, it's like hitting concrete. So they have to break the surface tension with their hands. They have to do that, don't they? So they put their two hands together above their head and break the surface, which means their wrists take a lot of the force. So we have to tape them, but you can't tape them in a position that won't give them full extension.
So tricky.
So you're just kind of going, I don't know how to do that because it's not what I do. I go, oh, you've got a sore wrist.
So something you had to learn.
Yeah, it was really cool.
Okay.
We got the head doctor would allocate us to different sports, so we all got to see a range and just have fun, have as much fun as possible while being as professional as possible.
Well, you mentioned that you had such a good experience, and again, it wasn't to do with money, that you've been asked, hopefully, to go back next year and do it again. Yeah. So it's pretty cool.
It is really cool, yeah.
Okay, we'll just move on. We'll just finish off. As far as you working with myos and massage therapists, have you had much experience working with myotherapists in clinic?
Yes. In clinic, so I currently work with 3, so 2 remedial massage therapists and 1 myotherapist.
Yeah.
I would say I've worked on and off with them in private practice over the years, but I've been teaching since 2007 in the myotherapy degree and in the advanced diploma.
So that's
of myotherapy.
at Southern Schools?
So I was, currently I'm at Southern School of Natural Therapies.
Yeah.
Prior to that I was at Chisholm TAFE in Frankston, and then prior to that I was at Endeavour College in Melbourne. And Brisbane. I taught at Endeavour in Brisbane as well.
What sort of things have you been teaching, or what do you teach now?
Oh, it's almost different every time, which makes it really fun because I get bored easily.
Yeah.
Joint mobilisation, soft tissue techniques, anatomy, anything with the word sport in it, I'll put my hand up for.
Okay.
Yeah.
Yeah, cool. And are we going to see some workshops from you one day in those particular areas?
That's the plan.
Yeah, that's the plan. So we'll probably be seeing a bit more at Kaz. The association's pretty keen to have you on board to do some workshops as well at some stage.
That's cool.
So that'd be pretty cool.
Yeah.
Any final tips you can give to the punters at home as far as looking after themselves? Because we've had a big sort of a theme over the last few months with Connect looking at self-care. As far as longevity in the game, can you offer any tips for people at home?
Yeah, there's so many.
Yeah.
Probably don't go too hard too soon.
Mm-hmm.
Don't think that you have to put in 100% of your body effort into each individual client or patient that you see. Because give yourself 2 or 3 years and you will be burnt out and worn out.
Yeah.
That's probably my biggest thing, is give as much of your knowledge as you can to that person on your table or in your room.
So making that, I guess, the relationship with the person on the table is really important.
Yeah.
And that's good for a customer point of view, I guess, as well. That when someone is injured or if someone is requiring some sort of treatment, then you become top of mind because you've got built that relationship up.
Yeah, definitely.
Over time.
They'll come back and see you for you, not because of what you've done.
Yeah. Okay, cool.
Yeah.
Good tips. All right, we'll finish off there. Guys, thanks very much for joining us, and we'll see you next time. See you later.
Okay, welcome members. Today I am going to introduce you to one of my favourite trigger points, and that is in the medial head of the soleus, and it mimics Achilles tendinopathy and plantar fascia beautifully, and as far as I'm concerned is usually involved in both of those conditions. So I'm just going to give you a little bit of an insight of how to effectively treat this, and I think it goes under the radar for most of the time because it is hidden in the medial portion. So a lot of what I do in terms of treatment of, say, Achilles or plantar fascia is in this side lying. It has a lot to do with this medial compartment. So I'm going to show you how to address this trigger point, and I'm going to show you how to address it effectively as opposed to just skimming over it. So I really feel that in terms of treating trigger points, you really need to engage them and really work through the whole component of the taut band. So that's what I'm going to show you today. All right, we're going to use a little bit of cream just to start with. And the idea for this is we're going to search along the belly of the muscle. So, as we know, the soleus comes down here, pins up against basically what we have here, which is the tibia bone. So we all should be aware of that. Where the trigger point is up in this, just this small portion in the medial compartment here. So, in order to treat this effectively, we'll work through just with some longitudinal gliding first. So it's a sort of a preparatory sort of type stroke. And then we're going to come in with, now believe it or not, we're going to come in with the fleshy part of our forearm. So we're just going to glide up and along the medial border off the tibia and pick up that trigger point in the medial soleus. Now, I know it looks aggressive, but it's actually a big, broad, firm pressure. So once you find that trigger point there, like I did on James, right here, it's a matter of just sitting into this area here. So if you point your elbow, that will be too much. So it has to be broad and firm. And remember, when we're working these trigger points, we're working the region, not working a spot. So the idea is that we explore that. Now, one of the things that I like to do is just bending the toe, and usually the big toe, up and down as I work this trigger point. So I'll sort of nestle in there, which is about there, James. And you will tend to find you'll get a referral down into that medial portion of the Achilles, even into the attachment, and then also deep into the plantar fascia area as well. It varies from person to person. So we just sit on there, work that big toe and just wait for that to just ease and melt away. So sometimes you might sit here for about a minute, sometimes 2. If you press too hard, you won't get that change. So it's really, really important that the pressure is comfortable for your client as well. So we just work toe backwards and forwards, and you can start to feel it melt away now.